Today on an all-new Dr. Phil. Doctors charged with sexual abuse.
He would do internal examinations.
And there were times he wouldn't wear gloves.
I'm in a hospital gown. I went to take off my knee-high boots. He said, oh, no, leave your boots on.
He used the ultrasound device.
In a sexual way.
I reported it. Nothing was done.
So they knew and continued to feed you into his hands. These colleges and universities end up paying huge settlements. I'm talking huge to victims. USC paid out over $1.1 billion to victims. Michigan State University, over $500 million. University of Michigan, $490 million. And most recently, UCLA will pay over $700 million in settlement payouts. That's just so far. Over $2,790 million in total. Now, in 2019, Dr. James Heaps, a highly regarded UCLA obstetrician-gynecologist and oncologist, was arrested and charged with sexual battery by fraud and sexual exploitation. Within months, hundreds of former patients came forward. Now, today, here, 4 women tell their stories of being victimized by a white coat predator who had allegedly been preying on his patients for decades. You saw Dr. Heaps for 8 years, right?
Yes.
And looking back, you now know every time you saw him, you feel like you were assaulted by him.
Absolutely.
Tell me what you feel comfortable talking about and how you were manipulated into coming back time and time again.
Sure. So the first time that I went to Dr. Heaps' office, and let me preface by saying at the time, I consider him Dr. Heaps. At this point, he's no longer a doctor. Since his conviction, he will no longer have his license ever again, and he will always be registered as a sex offender. But at the time, I went to his office and knew that I had had some misdiagnosis in the year prior, and I had been told that if I wanted the proper treatment, I needed to see the very best doctor in the entire area, and that was Dr. Heaps. The first time I went into his office, he took me into his private office, not into an exam room, and spoke with me a bit. And I explained my situation, explained an autoimmune disorder, and he immediately told me that I was at a very high risk of terminal cancer and that he would need to monitor my condition very frequently, and that he himself was the only doctor in the area who knew how to treat the condition and that everyone else treated it improperly. So from that moment, I was terrified. No one had ever told me that. Since that time, I now know that that's incorrect information. I'm at no greater risk than you or anyone else.
Yeah.
But he instilled fear in me to ensure that I would return frequently.
So you believe that the grooming started right then?
100%. I think for most people, when you hear the word cancer, it's terrifying. And I had a toddler at home at the time, and all I could think of is, I want to be alive to see her graduate high school. There's no way I will do anything to risk that. So of course I'll do what this doctor, who was highly recommended and was at UCLA Health, if he tells me to come, I will come.
So look at the elements here, and this is what I want people to recognize. Look at the backdrop. He's at a world-renowned medical center. He's got all the entrapments and all. He puts the stakes as high as they can possibly be, your life, and says he's the only one that has any information about this that could potentially save your life. So then he gets you on a schedule coming in, and you say he performed very thorough internal exams and with great frequency, more than you had ever had with any other doctor in any way whatsoever.
Yes. For instance, in the first 12 months that I was a patient in his office, he asked that I come back 7 times. And I now know that was completely unnecessary. A once-a-year annual exam was all that was needed. And every office visit included internal examinations, which I also know an autoimmune skin disorder does not require anything internal at all.
Yeah. And there were times that he wouldn't wear gloves?
Correct.
So straight skin-to-skin contact?
Correct.
And was there a chaperone in the room?
Not at all times. And when there was a chaperone, often The chaperone would turn and face a computer or appear to be busy elsewhere and not watching what was going on during the exam.
And he would make inappropriate comments about your body, body parts, things of that nature.
Yes, he made comments about the appearance or attractiveness of different parts of my body. He commented about the size in comparison to other women.
You've been listening to everything we've been talking about. And Nicole, it's sickeningly familiar, right? I mean, you listen to this and the whole pattern, the whole interaction, it's an MO is what it is, right?
First of all, thank you for having me.
You bet.
It's incredibly difficult. When something is happening to you that you are completely not expecting, being in a professional medical environment, the last thing that you think is that you're not going to be safe. And so when something happens that is so incredibly horrific, you don't want to believe it. So even though your instincts are right on, you tell yourself a different story. For me personally, it took some time to report. It was difficult saying out loud what had happened.
Yeah, well, it is, because first you have to process it. It's hard to wrap your mind around, right? You start to second guess, you start to reprocess, run through your head, but something nags at you. You just know this is not right. And
Absolutely.
then when you hear, yeah, it ain't just me, then all of a sudden things start to fall in place.
Well, in my case, I didn't know
You
that
didn't
I
know
was,
those.
no, I had no idea. I came forward because I needed to do that for myself.
What did you think when you found out that there were so many, hundreds and hundreds of others?
I was horrified. I had no idea the scope of what had happened.
Yeah, well, it's hard to imagine. Gabby, you actually were employed
Correct.
as a medical assistant, right? Not for him, but you were employed at the medical
Correct.
center, right?
First of all, thank you for having us here and giving us this platform, as it is hard for me and everyone else. This is something really hard. You trust in these institutions and you think that by reporting it, someone's going to come to help, and no one does. And you get to a point where you think it's me. I did something wrong. Maybe I'm doing things wrong and he's right. And like they said, this doctor was highly recommended. He's the best of the best. If you go somewhere else, the chances of your treatment are not going to be as good as staying with him. And what I went through was horrible. He used a ultrasound device and did wrong things to where I was bleeding, and he said it was normal. I've had pelvic ultrasounds, and this never happened. So I knew something was wrong.
Darren and Jennifer represent 312 women who all have made claims that they were abused under the guise of medical treatment. And we've just heard what Gabby has said. You guys have represented them. You do represent them legally, but it's been more than that. You've taken on their case, but you've also taken on their cause. You've taken on a partnership with their lives.
Yes.
Fair statement?
Absolutely. And we're so honestly grateful to you, Dr. Phil, for doing this show, because we also know, and our whole group of 300 plus know, that there are others out there. There are women across the United States who will wake up tomorrow and go to an appointment. They may be questioning themselves. They may think, oh, it must be me. It must be my fault. I'm feeling that something's wrong with a certain physician or doctor, and it must be me. I shouldn't say anything. And we really want them so much to know that it's okay to speak out. It's okay to talk to someone trusted about that. And we really want them to consider doing it because it's so incredibly important. And it is difficult, but we've seen these wonderful, brave survivors transform through this process, and they're able now to talk about it, and it can be healing. So yes, we're so proud of them.
When you look at the timeline on this, the patient one complaint was in 1999.
Right.
Correct.
That's when it was, and it was not investigated. And then Ellen, from 2010 to 2018, you see him 12 times a year in here, and then 2013 and 15, you see him 3 times assaulted each time. Then here, employee one, verbal complaint, not investigated. Then a written complaint taken no further. That's what you say, it's not escalated. Okay, now this is going on. You're seeing them here, you're seeing them here. So when you look at what's going on, this overlaps this. So you guys are seeing this while this is going on, and nobody's telling you anything about this. So they know it. And then here is an online complaint, no evidence of investigation. And then, Gabby, you see him 4 times, assaulted each time. So this, and all of this is happening. So they knew that there was something that at least rose to the level of being worthy of examination, investigation, or whatever, and continued to feed you into his hands.
Dr. Phil, that's one of the most outrageous things about this is after UCLA knew, they continued to pack his waiting room full of victims.
It continues on until finally he's arrested in 2019. But in 2018, they tell him at one point to take a vacation. You see in 2017, but then he comes back in 2018 and continues practice. There was enough evidence for them to say, you need to take a vacation starting today.
It's
you need to get out of here. Then he comes back and resumes practice, and you see him after he has been ordered to step down, take a vacation.
If the institution had done something about it in 2015, I wouldn't have been so graphically assaulted to where I can't even speak about it on television.
Yeah.
It's too graphic of nature. It left me bleeding. It left me scarred for life. It left me with something that I will have to deal with for the rest of my life. And
I think to your point, Phil, even Ellen's story is especially poignant in the last point that you were making, that as she can describe, she should not have seen him. She saw him just days before he retired and walked out of there.
Yeah, exactly. Just days before, right?
Yeah, my final appointment was on a Tuesday, and apparently he closed his doors on that Thursday.
With mixed emotions.
A week later, we received a letter from the university saying that he'd be retiring, and they were announcing that with mixed emotions.
Practicing medicine is a privilege. It's not a right. Not only is it about competency, it's about conduct. Tomorrow on an all-new Dr. Phil.
I would think about suicide every day, all day.
America's teen health crisis.
I'm asking for help. I've been begging for help. When I was 14, I started sleeping with older guys.
You didn't have sex with some guy when you were 13 or 14. You were raped.
Sorry, I'm gonna cry. I've just never felt understood.
I'm really sorry that there was no one around to tell you the truth, but I'm here now and I'm telling you the truth right now. That's tomorrow. Check your local listings. Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.